Hi, my name is Ryan Chow, and my presentation is on the measurement method for analyzing corneal stroma change. The cornea is the protective outer layer of the eye. The corneal stroma makes up the vast majority of the cornea and supports blood vessels and nerves to the epithelium layer. On the right, we have a diagram with a cornea labeled. The thickest layer, which is also the light blue layer, is the stroma. Imaging of corneal stroma can be used to track changes, but analysis of such images in the past have failed to quantify these changes in a more standardized method. An example of an image is below, where we have an example of an OCT image that includes the epithelium and stroma layers. That leads us to our main research question. What is a better method of measurement for tracking corneal stroma change? Importantly, our measurement procedure includes the use of the ImageJ application, followed by the standardizing of data, followed by the plotting and graphing of data. The ImageJ application allows us to measure the corneal stroma in two different methods, one being by thickness and the second being by area. The procedure and measurement of thickness is as follows. First, the line selection tool is used. This allows us to calculate measurements by drawing lines in 45, 90, and 45-degree angles. These lines are shown as yellow in the example image below. The measurements were then averaged. Now, the procedure and measurement of area is as follows. The freehand selection tool was used, and measurements were made by circling the area of interest, as highlighted in yellow in the example image below. Both of these measurement methods can be used numerous times on multiple images over an extended period of time. The data from multiple images can be averaged to best track any trends that occur. After averaging the data, it is standardized. Standardization occurs by converting units to pixels versus the default unit of the images in ImageJ application. The data is then plotted. Standardization occurs with this formula. The data value from ImageJ is first used, multiplied by the length of the cornea multiplied by 100, and all divided by the pixels from the image side. These are all hypothetical numbers, but if we calculated using this formula and these numbers, we'd get the value of 1150. When is this method used? In Dr. Yu's research lab, we have used this method to analyze OCT images of stroma changes in rabbits over different time intervals. We start with a pre-surgery OCT diagram, followed by surgery occurring in lamellar keratoplasty, which is the removal of corneal tissue, and we have gelling by blue light, which allows us to track these changes in OCT images. Post-surgery, we can see that it is a very different OCT image from pre-surgery, as we have a decreased amount of stroma compared to the pre-surgery image. We follow this up by tracking changes after 14 and 28 days or 2 to 4 weeks, and we attempt to monitor the corneal stroma change longitudinally. The results are as follows. On the left-hand side, we have a graph for the cornea change by thickness, and on the right-hand side, we have the graph for the cornea change by area. The gel thickness is maintained after 4 weeks in both measurement method techniques, and there's a downward trend present after post-operational levels. In the stroma, the thickness and area return to pre-operational levels after 2 weeks, but continue to increase at week 4. Both measurement methods are comparable with similar trends in data. This slide houses the conclusions and the analysis of the graphs I have just shown from the previous slide. Feel free to use this slide in conjunction with the previous slide to further your understanding of this presentation. The challenges we face include that this method of measurement is most susceptible to human error and image consistency. ImageJ has functions like the freehand selection tool that we utilize, but this tool is human dependent in terms of identifying the area of interest. This means the measurement will rarely ever be perfectly accurate. When analyzing images over a time period, the images would be ideally taken in the exact same position and perspective. However, after 2 weeks or 4 weeks away from your experiment, it is difficult to consistently take the exact same image every time, leading to slight inaccuracies. The solution includes the development of new image processing program. We need a gold standard to evaluate our methods. Utilizing histology, we can calculate collagen amount in the cornea tissue, and we can also calculate the whole stroma volume using a 3D reconstruction of the whole stroma. This is all done by some sort of software or program that is much more precise. The goal is to use this measurement method for future ophthalmological research to better quantify changes in corneal stroma. We aim to reduce human error impact in this measurement method for the future. This measurement method can be diversified to be used for other branches of research, for example, tracking changes in other human organs like skin. Huge acknowledgements to Dr. Samuel Yu, Dr. Minji Chen, Shani Simmons, and Dr. Kannan's lab for performing this research and allowing me to present on this research.